You know, breast cancer isn't easy. I should know. My name is LaDonna Apodaca. I live in El Paso, Texas, and I'm 48. I'm a two-time cancer survivor. 7 years ago, my vocal cords were damaged by treatment for thyroid cancer, and just last summer, I was diagnosed with breast cancer. I'm married and have a 13-year-old son named Christian. I'm a full-time mom and a part-time artist and designer. My family also owns a restaurant, and I'm just busy all the time. Thank goodness I found my cancer early, so it was treatable. Most women diagnosed with breast cancer won't die from it, but it will change their lives completely, as it changed mine. Thanks to regular breast cancer screening, like breast self-exams, mammography, and ultrasound, more and more breast cancers are being found early when they're very treatable, like mine was.
Hi, I'm Dr. Pamela Benitez, a breast cancer surgeon at William Beaumont Hospital in Royal Oak, Michigan. Over the past 30 years, breast cancer treatments have realized significant advancements. Early on, mastectomy, which is removal of the entire breast, was the only treatment option we had to offer women with early-stage breast cancer. But that changed in the 1980s. Through research, we learned that we didn't have to remove the entire breast when the cancer was caught early. We could be just as successful fighting the cancer if we removed only the portion of the breast tissue with the cancer cells, as long as the patient also received follow-up radiation treatment to her breast. Removal of the cancer, plus a small rim of healthy tissue around it, is called a lumpectomy. Now, when a patient has a lumpectomy with follow-up radiation, their survival rates are just as good as if they had a mastectomy. And she's able to keep her breast. Traditionally, after the lumpectomy is performed, radiation is delivered to the entire breast in a series of treatments, Monday through Friday, for a period of 5 to 7 weeks. This is a problem for some women because they either live too far away to come every day, they have to work, and can't afford to take off the time that is needed for whole breast radiation therapy, or they are busy caring for their families. Through research studies, we have learned that breast cancer is most likely to recur in the area of the breast right around the lumpectomy bed. MammoSite, targeted radiation therapy, delivers the necessary radiation directly to the tumor bed, the site where the cancer is most likely to recur. And the greatest benefit of MammoSite therapy is that the necessary radiation is delivered in just 5 days instead of 5 to 7 weeks.
It was over in 5 days, and you get back to your life. It's like cancer is not going to be a part of my life that's going to take it. It's over with. I'm done. I've got the treatment completed. I'm back to my life. I can clean my house. I can cook. I can work. I can go to church. I can go sing in the choir. I can do my volunteer work that I do. I can do whatever my body is able to do, and I am back. I have not been defeated by this, and I am very glad to be back to a normal life right now.
The MammoSite itself started on a Monday and ended on the Friday of the same week. Every single day I would go to the MammoSite place in the morning, get a treatment, go home, and then go back to the MammoSite place at around 3, 4 o'clock, get my second treatment. And on the 5th day after the 10th treatment, they pulled the catheter out and said, toodaloo.
Since the MammoSite radiation therapy system was cleared by the FDA in 2002, it has become the most widely used method of partial breast irradiation with over 32,000 patients treated. Let's talk about how MammoSite therapy works. After the lumpectomy is performed, which includes removal of the cancerous breast tissue and some surrounding normal tissue, radiation therapy to the breast is needed to minimize the risk of cancer recurrence in the breast. Then, Treatment with MammoSite targeted radiation therapy is carried out in 3 simple steps. Step 1 is placement. An uninflated MammoSite balloon catheter is gently placed inside the lumpectomy cavity through a small incision in the breast. The balloon is inflated with saline solution so that it fits snugly in the lumpectomy cavity. The MammoSite balloon remains inflated during the 5-day treatment. A portion of the catheter remains outside of the breast. During treatment, the portion of the catheter that remains outside the breast is connected to a computer-controlled machine. A thin wire with a tiny radioactive seed moves up the catheter under precise computer control into the center of the balloon. The seed irradiates the tumor site and the area immediately surrounding the cavity where tumors are most likely to recur. After the prescribed dose of radiation is delivered, which is typically over a 5 to 10 minute period, the seed is removed from the balloon. No radiation remains in the breast in between treatments. After 5 days of treatment, with 2 treatments per day, the MammoSite balloon catheter is gently removed through the same incision that was made to place it in the breast. Most women feel little or no discomfort either during insertion or during removal. In my experience, most patients tolerate MammoSite therapy very well, with only some redness around the site of the treatment and with less fatigue than is sometimes experienced with whole breast irradiation therapy.
When I started my MammoSite treatments in Augusta, Georgia, I felt good and I thought, well, I'm sure the next few days I'm going to start feeling tired. And my husband at that time said, well, maybe I ought to go with you tomorrow. I said, no, let me go. Well, I decided to take a girlfriend with me the second day, and I had my treatment. We went out shopping. I tried on swimsuits, in fact. The catheter was so small, it fit right. I wore a sports bra. It tucked right in there. It was no problem. We went out to lunch. That evening, I thought, well, I wonder if I'm going to feel good in the morning. And I woke up feeling great. After that 3rd day, I knew I could get through the next 2 days with no problem.
The side effects. Yeah, there'd be maybe some discomfort, maybe a little peeling of the skin around there. But work, I could go back to work. The treatment itself would be 5 days versus 6 to 8 weeks. The body image, there would be no really problems with that.
In review of study data that are in published reports, MammoSite radiation is well tolerated. The most common side effects include redness, bruising of the skin, and breast discomfort. These did not occur in all patients. These are all common side effects after breast surgery or radiation therapy and usually go away after a short period of time. Occasionally, there is a little drainage that occurs from the catheter insertion site, which is normal. You should talk to your doctor about the risks, benefits, and any side effects of your treatment.
Having breast cancer is a life-altering experience, but I feel blessed to be a breast cancer survivor. Because breast cancer isn't easy, the makers of MammoSite have put together a volunteer program called Voices of MammoSite. It includes women around the country who have received MammoSite. They have volunteered to talk to women who are considering MammoSite 5-day targeted radiation therapy. You can connect with a MammoSite volunteer. Good luck on your journey.
Let me tell you something. I'll never, ever be the same. Never. I am so grateful. I am so grateful for my family. I am grateful for medical science for all that it can do. I am grateful for MammoSite.
This video is sponsored by the makers of MammoSite 5-day targeted radiation therapy. While there are many options for treating breast cancer, including surgery, chemotherapy, and radiation therapy, the women in this video were treated with MammoSite 5-day targeted radiation therapy.